This is Bruce Jansen with the Oncology Report at the San Antonio Breast Cancer Symposium, where I'm speaking with Dr. Edith Perez of the Mayo Clinic, Florida, about some exciting new findings in the realm of predicting response to Trastuzumab. Tell us what you found.
Yeah, well, our data are very exciting and the product of teamwork. But essentially, we and others have demonstrated the significant benefit of adding Trastuzumab to chemotherapy to decrease relapse and improve survival in breast cancer. At the same time, we know that still about 25% of the patients develop tumor relapse at 5 years. So now that we have extraordinary tools to evaluate genomic profiling, we took advantage of these new tools to come up with our report at this meeting. So what we did was that we conducted whole genome analysis of specimens from patients who participated in our large Trastuzumab adjuvant trial called N9831. Specifically, we looked at 29,000 transcripts. So we correlated the expression of those gene transcripts with patient outcome in terms of relapse-free survival. And our findings demonstrated that we could identify 32 genes that correlated with patient outcome. 27 of those genes correlated with good clinical outcome, and 5 of those genes correlated with not so good clinical outcome, and that was at a p-value of less than 0.001. This is the first time this type of information is reported in a large set of patients receiving adjuvant Trastuzumab with chemotherapy. So we think our data are really important.
Do you think this is likely to translate into a new genetic test?
We hope we get there, but as we look towards that possibility, we have some steps that are planned. Number one, we want to validate our findings utilizing annotated specimens from other adjuvant trials that have been performed globally. And we are very fortunate that we have obtained already an agreement from investigators here in the United States and in Europe to collaborate with us. And again, this is exactly what we want to eventually accomplish, develop a new multi-gene marker test that may be helpful to optimize the decision-making of how patients may fare when they receive adjuvant Trastuzumab.
Exciting new findings from the San Antonio Breast Cancer Symposium. Thanks very much.
My pleasure.